Hi class, this is April again with INFM 645 for Mercer University. Today we're going to be talking about risk management professionals. What is their role, responsibilities in the healthcare setting? The first question is regarding what are the functions and responsibilities of a risk management professional in a healthcare setting? Well, according to our text, Risk Management Handbook for Healthcare Organization, the RMP has 6 functional areas of responsibility. One being loss prevention and reduction. This is the largest function area, and it includes everything related to risk prevention, from education of staff on the way to spot and report potential risks to development of programs and policies for everyone in the organization to follow and to remain compliant. An example of this is at my workplace, we have a yearly computer-based risk management course that we take pertaining to our current role and also to specific risk factors involving the company. Another functional area for an RMP is claims management. This includes all activities associated with managing actual and potential claims from reporting and investigation to resolution. An example of this is a case of a medical incident involving an employee who may have contributed to the fall of a patient. It would be the RMP's responsibility to receive that report and facilitate the investigation directly or through other third parties. Another functional area is risk financing. This includes many activities associated with financing losses, whether the organization transfers or retains the risk. And what it is meant by transferring of risk is that most of it, if not all healthcare organizations, have insurance to protect the physician or clinician of the facility. Basically what happens is that this protection is in form of an insurance policy that protect their interests, basically their money, should a claim arise from medical negligence by a physician or a clinician. If the RMP decides to retain the risk, this means he or she will perform all due diligence to mitigate the case for the organization, basically resolve the issue in-house. The fourth functionality is regulatory and accreditation compliance. These activities associated with compliance and accreditation of standards and with major healthcare regulations. What this means is the RMP's primary focus is promoting the requirements of compliance by the entire organization with the policy and programs he or she has established, along with the collaboration and support of the board of directors. The fifth functionality is risk management operations. This is the area where the RMP establishes his or her own team of people that will execute policies to and for the entire organization. It can include training and supervision of the RM staff, development of goals for the RM department, and coordinated efforts with other departments such as patient safety committees to maintain stance on RM policies for the entire organization as well. The last functional area is bioethics, and this includes activities that are related to issues such as do not resuscitate, a DNR, orders, brain death criteria, advanced directives, withdrawal of life support, human subject research. The RMP will have to ensure that his or her policies are compliant with all state and federal regulations pertaining to these sensitive issues, protecting patient rights, their families' rights, as well as the organization rights. Now, our next question is pertaining to who do RMP, the risk management professional, report to. He or she could report to a number of people, actually. A CEO of the company, senior vice president, director of risk management, director of quality even, or just simply the board of directors. It just basically depends on the size, the type, and the organizational structure of the facility. Our last question is, what is the relationship of the RMP with the board of directors? Well, this is a very complex relationship, very involved. It involves, first of all, it should involve respect for the from the board of members to the RMP. This individual who maintains and enforces their agreed upon policies and procedures to the masses should be respected by the board of directors. And he also is basically like an informant, a person who has invaluable information to present to the board of any potential risk to the organization and culture, including staff, clinicians, and suppliers. Because the EMP access is confidential information of the organization, this individual should have an open and approachable relationship with the board to feel comfortable to share any potential risks associated with mergers, especially if there's a conflict of interest with the board member or the company as a whole. So basically, a risk management professional is responsible for a lot of things in the healthcare industry. Not only risk management of patients and clinicians and physicians, but the overall structure of the company as well, to make sure that all goes well, that that he lowers or eliminates any risks or potential risks that are involved in the organization, and keep the culture and the agreed upon policies and procedures of the company enforced throughout the company. Thank you for watching. Bye.